Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Olivia Komjisha recently recovered from the COVID-19 infection. However, her high hopes to return to her usual journalistic work have been stifled by prolonged post-recovery effects of the infection.
I remember I was seated in the newsroom and I was feeling cold and everyone was asking, I was telling them, you guys, it's really cold. And everyone was like, are you okay? It's not even cold. So I was all covered up, I was shiverish. So one of my bosses told me, you know what, just go home.
2 weeks after recovery, she's unable to hear well and continues to present symptoms of COVID-19.
I still get flu at least every evening. There are days when you still really struggle for breath in the night. Then for me, my biggest challenge really has been the ears. They get itchy from the inside, they get painful, they make the head really heavy and you get serious headache.
This is the second time Komjisha has contracted and recovered from the disease. Unaware of how long this may last, she's now torn between resuming work and what to expect from the symptoms.
The body's looking up to nothing. Like, it's overwhelmed. It's really overwhelmed. You're tired from doing nothing. They've told me give it a month and see how they change.
Just like Komjisha, experts around the world are working to learn more about short and long-term health effects associated with COVID-19, who gets them and why. Dr. Angela Atukunda, a physician who has been treating COVID-19 patients at Mulago National Referral Hospital, explains what they know now.
So the ongoing COVID-19 stage usually lasts from 4 weeks to 12 weeks. Now, when someone persists to get symptoms after 12 weeks, that is long COVID, what some people have called the COVID syndrome.
The effects have been categorized according to new or ongoing effects and multi-organ effects.
It can affect the brain, it can affect the gastrointestinal system, the stomach and the intestines. That's why some people get diarrhea, abdominal pain. It can affect the eyes. Some people have blood vision. It will affect sensation of any part of the body, and then someone will not be able to smell, to taste, even to hear. Some people get neurological COVID-19 and they will stay with a persistent headache.
Dr. Atkunda says some of the effects are a direct result of intensive care hospitalization due to severe disease.
Because when someone was on oxygen and now they have to breathe on their own and maintain their own saturation, they feel very tired from breathing, even from any other thing that they do. So even walking the slightest distance is very hard for them.
Experts around the world are continuing to study the effects of COVID-19 to sexuality and reproduction in both males and females. Dr. Atukunda says there is some data on erectile dysfunction and changes in menstrual periods.
Erectile dysfunction is 6 times more common among patients who have recovered from COVID-19 compared to the general population. This is research. So if someone got endothelial damage, for example, in their male organs from COVID-19, it can lead to some form of erectile dysfunction. If it happens that for the lady, the lining is affected, she will get some issues with menstruation. But of course, it is a new disease. We don't know what will happen in 5 years, but it is anticipated that all that should resolve. The endothelium usually repairs itself and it can normalize.
Mulago Hospital established the post-infection care clinic to address such problems, but the lockdown has limited access to the facility.
How do I get there? All we are relying on is, you just call a doctor and they tell you, use this. But you can't get a patient-doctor interaction.
The way out that we have is observe the SOPs, vaccination.
The fact that the COVID-19 infection is still a new disease leaves a lot to worry for health workers in the country. because of the long-term side effects that cannot be defined at this particular point. They say there may be a requirement to have specialized services like heart and lung transplants, services which are not available in the country. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities